Question 1. A 65-year-old man comes to the clinic due to gradual onset of blurred vision over the past 2 months. He also has difficulty driving at night and reading fine print. His past medical history is notable for diabetes and hypertension. The patient's medications include ramipril and metformin. His vital signs are normal. His best corrected vision is OD, right eye, 20/80, and OS, left eye, 20/100, with normal findings on visual field testing. Ophthalmoscopic examination with pupillary dilation reveals a loss of transparency of the lens in both eyes. The red fundal reflex is normal, but retinal details are difficult to visualize. What is the most likely diagnosis? The best supported option is A, cataract. This patient's painless, gradually worsening vision loss, along with difficulty driving at night, trouble reading fine print, and an exam showing loss of lens transparency with normal red reflex, strongly indicates cataracts. Cataract formation results from lens opacification and is commonly associated with aging, diabetes, and hypertension. In contrast, macular degeneration causes central vision loss with visible drusen on fundus exam, which would not be obscured unless the lens were opaque. Open-angle glaucoma leads to peripheral vision loss and elevated intraocular pressure, yet this patient's visual field testing is normal. Retinal detachment presents suddenly with flashes, floaters, and curtain-like vision loss, and typically alters the red reflex rather than preserving it. Therefore, these alternatives are unlikely. Question 2. A 4-year-old immigrant boy is brought by his mother to a medical camp for the uninsured for the evaluation of his inflamed right eye. He has had a nasal discharge for the past 10 days. His brother has similar symptoms. His vital signs are stable. There are follicles and inflammatory changes in the conjunctiva of his right eye. The cornea shows neovascularization. What is the most likely diagnosis? The best answer is B, trachoma. This child's follicular conjunctivitis, chronic ocular inflammation, and corneal neovascularization are hallmark features of trachoma caused by chlamydia trachomatis serotypes A to C. It typically affects children in resource-limited or crowded environments and spreads through respiratory secretions, which also explains why his brother has similar symptoms. However, herpes simplex keratitis usually produces painful unilateral redness with dendritic corneal ulcers rather than follicles and neovascularization. Likewise, orbital cellulitis presents with fever, significant eye pain, proptosis, and restricted eye movements, none of which are present here. Moreover, viral conjunctivitis may cause watery discharge and conjunctival injection, yet it does not lead to corneal neovascularization. Hence, these alternative diagnoses are far less consistent with the clinical picture. Question 3. A 65-year-old man comes to the emergency department due to sudden onset painless vision loss in the right eye that began several hours ago. The patient says, "It was like a shade dropping over my eye." He had a similar episode 3 months ago that resolved spontaneously after several minutes. He has never seen flashing lights or floaters in his eyes. The patient's medical history includes hypertension and hyperlipidemia. Temperature is 37.1 degrees Celsius, blood pressure is 150/90 millimeters of mercury, pulse is 72 per minute and regular, and respirations are 14 per minute. Visual acuity is 20/20 in the left eye and 20/200 in the right eye. Fundoscopy findings of the right eye are shown below. Which of the following is the most likely cause of this patient's symptoms? The correct option is A, arterial embolic occlusion. This patient's sudden, painless monocular vision loss, described as a shade dropping, along with a prior brief episode, is characteristic of amaurosis fugax progressing to central retinal artery occlusion. The classic fundoscopic finding of a pale retina with a cherry red spot strongly supports an acute arterial embolic event, most often originating from carotid atherosclerosis in patients with hypertension and hyperlipidemia. By contrast, malignant hypertension would produce retinal hemorrhages, cotton wool spots, and papilledema, none of which are mentioned, and the blood pressure is not within the malignant range. Similarly, vitreous hemorrhage typically causes floaters and an obscured or hazy fundus view, which is not the case here. Additionally, central retinal vein occlusion creates a blood and thunder appearance with widespread hemorrhages, findings that are clearly absent. Consequently, these alternative diagnoses do not fit the presentation. Question 4. A 68-year-old woman presents with complaints of pain and swelling over the inner aspect of her right eye for the past 2 days. Examination of the eye reveals tenderness, edema, and redness over the medial canthus. Slight pressure over the area causes expression of purulent material. Visual acuity is normal. What is the most likely diagnosis? The most likely answer is D, dacryocystitis. This patient presents with acute pain, swelling, and redness over the medial canthus, along with purulent discharge on pressure, classic features of dacryocystitis, an infection of the lacrimal sac that often occurs secondary to nasolacrimal duct obstruction. The preservation of normal visual acuity indicates that the infection is localized and not involving intraocular structures. In contrast, episcleritis causes localized redness but is usually painless and does not produce purulent discharge. A hordeolum affects the eyelid glands, presenting as a tender nodule on the eyelid rather than swelling at the medial canthus. Similarly, a chalazion is a chronic, firm, painless eyelid nodule without acute redness or purulent discharge. Therefore, these alternatives are less likely. Question 5. A 3-day-old infant is brought to the physician with copious purulent discharge from both eyes. She was born by normal spontaneous vaginal delivery at home to a 20-year-old prima gravida who had no prenatal care. Examination shows lydedema and exudates. Which of the following is the most likely diagnosis? The correct option is C, gonococcal conjunctivitis. This 3-day-old infant presents with bilateral, copious purulent eye discharge and lydedema. The onset within the first week of life and severity are classic for gonococcal conjunctivitis, which is acquired during vaginal delivery from an infected mother. By contrast, chemical conjunctivitis occurs within 24 hours of prophylactic eye drops, is usually mild, self-limited, and not purulent. Chlamydial conjunctivitis typically presents between 5 and 14 days of life with less purulent discharge and a more chronic course. Viral conjunctivitis is uncommon in neonates and usually produces watery rather than copious purulent discharge. Therefore, these alternatives are less likely.